I definitely felt like the first time that I had somebody, do my wound care, probably standoffish. Didn't know what to think of them, because I don't know who's touching me. I don't know what it's going to be like. From the homeless perspective, we never know who's going to do what with our information. So we're naturally on the defensive, I think, about when it comes to like who we let help us.
So we hope that when we provide harm reduction care for someone in any way, in any setting, but particularly when we know people may have had negative experiences, we hope that providing a safe and responsive clinical environment can help people trust that they can receive that elsewhere. If we can support someone in knowing that their pain does matter, we hope that will not only increase their likelihood that they can access care, but also that they may be able to demand good, effective clinical care.
I build care and trust slowly, at the pace that the patient is comfortable with. I don't push too hard. I allow the patient to lead with what they want to discuss, what they want me to do. And little by little, I try to, maybe infuse a little bit of information that maybe I want them to know. I don't try to belittle what they want to do. If it doesn't align with what I want to do, I just respect that and always try to give them information. I want them always to be informed. So I'm going to give them the information and then they make the decision about what they do with that. And then I will come back and reassess and ask like, hey, did you think about what I said? What do you think about that? And then if they're not interested, that's fine. And I'll do whatever care they're willing to allow me to do. And I think over time, when people realize that you respect them and believe that they have the authority and the ability to make decisions for themselves, they trust you. Another important thing is doing what you say you're going to do. So I don't try to overpromise. I try to be very honest about what I can do. I try to be very honest about what are the outcomes of their care. And I think when people start to see that you're showing up for them in a consistent way, then that helps to build trust.
The advice that I would give other clinicians is advice that I also try to give myself, which is to remember how big my patients' lives are outside of the encounter with myself, and to remember how important it is to be really clear with my words and my actions, that I have a lot of respect for them, at the very least for their experience of their own life.